Hello guys, welcome to our channel VV Nursing Guide. Come, let's learn. First of all, which vitamin is essential for blood clotting? Vitamin A, vitamin B12, vitamin C and vitamin K. The correct answer is vitamin K. Vitamin K is essential for blood clotting. Then second, the normal range of hemoglobin in adult females is 8 to 10 gram per deciliter, 12 to 16 gram per deciliter, 16 to 18 gram per deciliter, 18 to 20 gram per deciliter. The correct answer is 12 to 16 gram per deciliter. The normal range of hemoglobin in adult females is 12 to 16 gram per deciliter. Third, what is the primary function of red blood cells? As you all know, RBC. To fight against infection, to carry oxygen, to produce hormones, and in the clotting of blood. The correct answer is to carry oxygen. The primary function of red blood cells is to carry oxygen. Fourth, which type of insulin has the fastest onset of action? That is regular insulin, rapid acting insulin, intermediate acting insulin, long acting insulin. The correct answer is regular insulin. This regular insulin has the fastest onset of action. Remember. Then, fifth one. What is the normal respiratory rate in adults? 8 to 12 breaths per minute, 12 to 20 breaths per minute, 20 to 30 breaths per minute, 30 to 40 breaths per minute. The correct answer is 12 to 20 breaths per minute. The normal respiratory rate in adults is 12 to 20 breaths per minute. Sixth, which electrolyte imbalance causes tetany? Hyperkalemia, hypocalcemia, hypernatremia, hypomagnesemia. Which electrolyte imbalance? That is hypocalcemia. Hyper means more, hypo means less. Hypocalcemia. Seven. Which pulse site is most commonly used to check an unconscious patient's pulse? Radial pulse, brachial pulse, carotid pulse, femoral pulse. The correct answer is carotid pulse. The most commonly used to check an unconscious patient's pulse is the carotid pulse. Eighth, which condition is characterized by an abnormal increase in white blood cells, WBC? That is leukopenia, leukocytosis, thrombocytopenia and anemia. Correct answer is leukocytosis. It is characterized by an abnormal increase in white blood cells, WBC. That is leukocytosis. Ninth, what is the normal pH range of blood? 6.8 to 7, 7 to 7.2, 7.35 to 7.45, 7.5 to 7.8. The correct answer is 7.35 to 7.45. The normal pH range of blood is 7.35 to 7.45. Then 10th, which is the most common site for intramuscular injection in adults? Deltoid muscle, vastus lateralis, ventrogluteal, dorsogluteal. The correct answer is ventrogluteal. The most common site for intramuscular injection in adults is ventrogluteal. 11th, which type of precautions is required for a patient with tuberculosis? Contact, droplet, airborne, standard. Which type of precaution? That is airborne precautions. Airborne precautions is required for a patient with tuberculosis. 12th, which is the first line treatment for anaphylaxis? Antihistamines, corticosteroids, epinephrine, oxygen therapy. That is epinephrine. The first line of treatment for anaphylaxis is epinephrine. Then 13. Which cranial nerve is responsible for vision? olfactory nerve, optic nerve, oculomotor nerve, trigeminal nerve. Correct answer is optic nerve. Optic nerve is the cranial nerve which is responsible for our vision. 14. Which organ produces insulin? Liver, pancreas, kidneys, or the stomach? The correct answer is pancreas. Pancreas is the organ which produces insulin. 15. Which electrolyte imbalance is most abundant in extracellular fluid ECF? That is sodium, potassium, calcium or magnesium. Correct answer is sodium. Sodium is the electrolyte. It is the most abundant in extracellular fluid. 16. Which condition results from a deficiency of ADH, antidiuretic hormone? Diabetes mellitus, diabetes insipidus, Addison's disease, Cushing's syndrome. Correct answer is diabetes insipidus. In diabetes insipidus, it results from the deficiency of antidiuretic hormone, that is ADH. 17. Which position is best for a patient who is experiencing shock? Supine position, Trendelenburg position, Fowler's position, prone position. Correct answer is Trendelenburg position. It is the best for the patient who is experiencing shock. 18. Which hormone regulates calcium levels in the blood? Thyroxine, parathyroid hormone, insulin, cortisol. The correct answer is parathyroid hormone. This hormone regulates calcium levels in the blood. Parathyroid hormone regulates calcium levels in the blood. 19. What is the primary function of platelets? Oxygen transport, immune response, blood clotting, nutrient absorption. The correct answer is blood clotting. The primary function of platelets is in blood clotting. Right? 20. Which part of the brain controls respiration? Important. Cerebellum, medulla oblongata, hypothalamus, frontal lobe. That is medulla oblongata. The part of the brain which controls respiration is medulla oblongata. Next 21. Which artery is commonly used to measure blood pressure? Radial, brachial, carotid, femoral. That is brachial pulse. Here, the artery which is commonly used to measure blood pressure is brachial artery. 22. Which of the following is a common symptom of hypoglycemia? Dry skin, shakiness, frequent urination, slow heart rate. Hypoglycemia, that is shakiness. Shakiness is the one of the following, that is the condition or the symptom of hypoglycemia. 23. Which organ is primarily responsible for detoxification in the body? Liver, kidneys, lungs or the stomach? The correct answer is liver. Liver is the organ which is primarily responsible for detoxification in the body. 24. What is the normal heart rate range for an adult? 40 to 60 beats per minute, 60 to 100 beats per minute, 100 to 120 beats per minute, 120 to 140 beats per minute. The normal heart rate, that is 60 to 100 beats per minute. 25. Which infection is commonly associated with prolonged use of antibiotics? Tuberculosis, Clostridium difficile, malaria or the hepatitis? The correct answer is Clostridium difficile. The infection which is commonly associated with prolonged use of antibiotics is Clostridium difficile. Thank you for watching.